The information shared in this episode is not intended to serve as a substitute for mental health services and is only intended to provide education and information to you, the listener. Thank you for tuning in to the Honeybee Podcast. We are going to get back into the conversation with Dr. O concerning the effects that deportation of a loved one has on a child's psychological and emotional functioning and methods to consider in being of support not only to the kid, but also to the partner or spouse of the undocumented person. Let's get into it. So to that end, and this may be a very big question, what sort of wisdom, advice, or just some flash of intuition that comes to you in regards to how listeners of this particular episode, how can we assist families and the individuals within the family? How can we be of support? How can we help enhance a healthy, well-balanced community of children?
That's a great question. I don't know how objective my answer could be. And we, as therapists, especially in the kind of framework that we both use, Vena, you and I, and other therapists of DBT, and being empathic and non-judgmental in general is so, so important for our mental health and for our ability to maintain healthy relationships and function. And so personally, I think understanding and validation and really kind of checking our judgments and checking for what we know. So much of the negative attitude towards it, sure, it's valid for everyone. Again, validation of, everyone's thoughts and feelings and emotions, but also curiosity, right? Like I've heard people, friends of mine even, not even colleagues, but just personal friends of mine say, well, gosh, 20 years? Like, why are you still undocumented? These people have no idea why. Just kind of making assumptions about it. You don't know how much it costs, if they have. And a lot of these people have been given temporary permission to be here temporarily.
Yes.
For example, you mentioned earlier the DACA and the DREAM Act recipients. And surprisingly, I actually have done two, evaluations on this particular group of people because there's different kinds of visas and applications that you can process.
Just in general, right? Like learning more. Are you inviting us to learn more about?
Absolutely. The more informed, and again, be careful with your sources of information, but the more informed that you are, I feel like the more curious you are, the less room there is to be judgmental. Like I said, some of these people have been given, work permits temporarily. Having a work permit in the United States doesn't mean that you have citizen rights or that you're here as a resident. That just means that you get a driver's license and that you're able to get a social security number and a 2-year work permit. Every 2 years, you have to reapply for this permit. So just kind of imagine that you're always temporarily here. You're always temporarily being allowed to be here, right? So all these little aspects of it that we don't understand, we should be more informed about.
Absolutely. Lead with curiosity. Practice checking your judgments, check the facts, practice validation, and also practice being understanding is a way that we can be of support to one another.
Absolutely. Just think of, and looking at it in the longitudinal perspective, the child that we talked about whose parent was detained, who's in, 5th grade or 6th grade or 7th grade, that's starting to externalize problems. This can be a long-lasting problem into adulthood, into young adolescence. People, that experience these things, they have a higher, not only the psychological effects, the extreme hardship in terms of their mental health, but also financial. this is a person who's, let's say their parent gets deported and now they're in a financial crisis.
Yeah, because with the amplified stress and the potential change in family dynamics and the effects of, the financial hardship, the emotional hardship, the mental hardship, that level of stress, especially during those critical points in life, like this pre-adolescent phase, this can lead us into aligning with individuals who engage, like you had mentioned, engage in criminal behavior, more risky, more impulsive. That impulsivity can go beyond that adolescent or pre-adolescent phase into adulthood, which then could create this transaction of having lots of legal issues due to this continued impulsivity, right? Because the stress, the amount of stress that has affected this kid and them being at this high crisis point for a lengthy amount of time does change the structure of the brain. So then I'm more likely, because I'm under high stress, I'm more likely to be reactive. I'm more likely to be impulsive. And that sort of, once we have this interface within the legal system or with authority figures, we're more likely to continue on that trajectory, especially if there's no letting up from that crisis point.
Absolutely. That's kind of the gist of what I wanted to say. Again, like you mentioned earlier, it's multifaceted. It's not just, someone has depression. And I know we've been focused a lot on the experience of children, in this conversation, but also spouses. Oftentimes the deported person was the sole financial provider for the household. So, for the sake of argument, let's say this was the father. So then that leaves the mother in a very tricky situation, right? Where she now is a single mother who maybe does not have work history or has not worked because she's, taking care of the children. And, that's kind of how their family is structured. And now their family is dissolved, essentially disrupted. She can have her own set of psychological problems, right? And her family is also experiencing their own set of psychological problems. And that's not even touching on the fact that, this person that's getting deported might have never been to that country ever, right? Just the other day, I spoke to a man who's 49 years old. His family brought him here from Michoacan, Mexico. When he was a year old, he's never been to Mexico. He has no family there. And now he's at risk of, going to a country where he's never been, possibly having more risk of, violence. Yeah. He's 49 years old, going, trying to get a job in a place where he's never worked before, never lived before. He has no ties in the community. His family is in, a different country. So it's not just one person with the psychological effects. It's a group of people individually and then, interpersonally dealing with these ramifications. And I think that's, where the empathy sets in and the understanding, because there's a lot that we don't know with these families going through these proceedings.
Absolutely.
One thing that I kind of wanted to touch on, because I know you asked me earlier about my role in, I guess, quote unquote, helping, and really kind of want to take a step back and kind of illustrate what these evaluations look like, if that's okay.
That would be wonderful.
The clinical interview is a very big part of it. That's where I obtain all the information in terms of what they've been experiencing. Is their level of function? Has it decreased, gone down, as a reaction to this event, or were they already experiencing psychological problems and this is just making it worse? But I also use objective information. So I, do assessments, depression scales, anxiety scales, because there is a referral question. The referral question is, what is the psychological harm that this person will experience if their family gets disrupted? What is the psychological harm that this person might experience if their spouse or parent gets deported and they have to go with them? This is another thing that families have to deal with is, should I go or should I stay, right? Are children better off going with their parent who's being deported, but with potentially limited access to education, healthcare, other opportunities, or to remain here without their parent with a wide array of opportunities, but without one or both of their, main support systems. So I, utilize these scales to just to give me a little bit of more information in terms of what symptoms are going on. There's only so many symptoms that I can ask about and assess, in the 2 hours that I meet with this person.
Right.
So that gives me the depression scales and the anxiety scales or behavioral scales. They give me more information in terms of how often, what symptoms seem to be happening more than others. Sometimes the people that, come through my door don't even think they have a problem really. Right? Like
because they've been living with it for so long.
Yeah. Or maybe they kind of, there's a stigma, against mental health. And like I said earlier, a lot of the individuals that I see have never sought treatment for their mood problems or their depression problems or, their kind of changes in eating. So they don't know that this is a symptom of depression. For example, you and I both know that psychological problems can cause physical problems, right?
Yes.
Like hypertension, stress-related things going on. Overeating can cause, significant weight gain. That's a risk factor for other health problems. So again, there's some psychoeducation that I try to use as part of, trying to teach them that this is a psychological problem. This could be directly or indirectly influenced by what is going on right now. And again, that's part of the report is my recommendations. Would this person benefit from seeing a psychiatrist for a medication assessment for his or her depression symptoms or anxiety? Would this child benefit from engaging in, a girls and boys club to increase their social support system or their access to activities? If, the child's been acting out at school or being aggressive, right? So really kind of looking at it also from an intervention perspective in terms of what can I recommend now to help this family that's in this state of crisis to try to minimize or mitigate the external stuff going on.
And so, Dr. O, I really appreciate you naming that because it gives a broader perspective and a better understanding of how this comprehensive psychological evaluation can be of support in not only providing information to the adjudicator or to the attorney about the after effects of or the consequences of the undocumented individual having to leave the country. It also gives a way to provide recommendations for intervention that not only helps the individual who is at risk of deportation to also help their family with decreasing stress and increasing effective behaviors and increasing the quality of life in a pleasant way.
Yeah. Can I just say, something else? Some of the families don't talk about what would happen, right? Like, I think just in general, we try to have a positive outlook and hope for the best. But sometimes the decision might be unfavorable. And so part of my assessment is establishing, have you explored your significant other or spouse or parent, how you would cope if they were deported? That's another conversation that I like to have with these families because a lot of families avoid that conversation because it's emotional and it's hard and we don't want to think about that. But I think it helps to explore that. Just to kind of assess their sense of coping with this major significant life event, right? Like what am I going to do? How am I going to cope if, my spouse gets deported or my father gets deported? So really kind of assessing their own sense of coping, their own sense of resilience, their own sense of being able to, move on if this were to happen.
Mm-hmm. How do the families that you've had this conversation with, how do they react to that sort of question? Because when you just named that, I held my breath for a little bit.
I mean, it's an emotional topic. So, I've gotten different reactions. I've heard spouses say, well, I'd have to move too. I've heard spouses say, I don't know. I don't have an answer for that. Or I've heard other families say, we'll figure it out. We'll deal with it. We'll figure it out. So the reactions are different. I can't say like any single reaction. I notice that there is an avoidance coping strategy, that classical flight or flight that I see just in the person next to me. There's a pattern, there's a history of avoidance. So I point out that behavior. Again, educating the patient, the client, with knowing how they're reacting to this situation. When someone doesn't want to talk about an event like this, that tells me that there's some avoidance, there's some flight responses going on, because it's very emotional. It's hard to talk about it. It's uncomfortable. I don't even want to think about it. And so I really try to, emphasize that is probably going to do more harm than good in the long run to not talk about that as a possibility, because it is a big possibility. Not everyone is going to, be allowed to, given these waivers.
Right.
Yeah. And the extreme hardship is actually really hard to show.
What makes it challenging?
For who?
To show what the hardship is. What makes it difficult?
Well, just in general, again, like going back to the grief and how we deal with grief, it's expected that if you're separated from your family, there's going to be some challenges. It's not going to be, pretty, quote unquote. So extreme hardship is what, the fact that this deportation or this separation is going to cause extreme hardship is what the report can show or won't show. Not everyone is going to have extreme hardship.
I'm just taking that in because I'm envisioning the situation, and my automatic gut reaction is, of course, this is an extreme hardship. Mm-hmm. I'm at risk of losing someone that I love.
Absolutely.
And yet, to meet the criteria of extreme hardship as it relates to this particular process that we're speaking of is something totally different.
Absolutely. I mean, again, remember, part of this isn't just a psychological thing. A big part of this is the judicial system. These are, legal proceedings. And so the definition of extreme hardship, from my perspective, from our perspective as mental health professionals, is very different than that in a legal sense.
That's totally fair and valid. That's valid. I can't argue that point. Dr. O, I sincerely appreciate you for having this conversation. I know that this will provide a platform to continue conversations amongst individuals outside of this recording, of course. And this is something that we could speak about for hours because there's so much to build on from an emotional standpoint, mental, physical standpoint, financial standpoint, a legal standpoint. I appreciate you for kicking off this conversation. And I really appreciate you. So I hope that you have a wonderful day and you take good care.
Thank you for having me, Vena.
My pleasure. Lots of helpful, valid, and valuable information shared in this episode from Dr. O. I appreciate her explanation of the comprehensive psychological evaluation process as not only being helpful to the undocumented person in figuring out the appropriateness of their continued residency in the United States, also how the evaluation provides assistance to the family members who are at risk of having their loved one deported. Finally, Dr. O encourages us to lead with curiosity, non-judgment, and empathy as a means to support the individuals who are experiencing psychological and emotional pain related to the stress of this circumstance. Thank you so much for tuning in to the Honeybee Podcast. Until next time, peace.